time it is. Marvin Devine, Huber, Axel, and you know how we do. Yeah, I got the juice. Big game cool, make them look like cool. Always play it cool, that's the biggest rule. Forget what they doing, keep on doing that. I've been making loot since like 22. Ask me how I made it right here in the booth. I'm always pursued cause of what I pursue. That's greatness, yeah, I gotta make it, I got things to lose. Boy, wanna get in my crew, boy, you can't get in my crew. Me, Axel, and Huber, way too fireball. When this joint drop, better call the troops. And when you hear the drop, better raise the roof. Better raise the roof. You already know what happens when we link up. Let's go.
What's going on? What's going on? Welcome to a special broadcast of World Kidney News. I am your host, Steve the Kidney Nurse. Thank you for watching wherever you're watching from. And a big welcome to our brothers and sister kidney warriors from East Africa and all over the United States and across the country and world. Thank you for joining me. I had my guest, Moses Kennedy. He was behind the scene. Now he disappeared. So we're going to wait for Moses to return to log on. But how is everyone doing today on this Monday afternoon, wherever you're at? Right now, it's 12:13 p.m. Eastern Standard Time, right here in Washington, D.C. So again, my guest, Moses Kennedy, we had him in the lobby. Now we're waiting for him. We lost him. I'm not sure if it was a internet connection issue. So stand by with me while we wait for Moses Kennedy. And a big hello to Dr. David Moskowitz. Dr. Moskowitz, I will reach out to you. I haven't forgotten you. So as I wait for this gentleman to come back, I have a backup plan that I would do and that I would talk about. So until he comes back, okay, we seem to have Moses Kennedy back in the lobby section. So let me give Moses Kennedy, the ambassador the kidney ambassador of Kenya, the special VIP intro. Hey, Moses, how are you? Hey, Moses. Moses, can you hear me?
Can't hear you. I can hear you.
We're live, Moses. How are you?
I'm good still.
So, are you
I'm
having
good.
issues with your internet?
No, not today.
Okay.
No issue at all. I was just setting
Okay,
it.
so what's going on? I mean, we had you on the show about a month and a half ago, and we was experiencing issues with the internet. So, talk about dialysis in Kenya. Tell us about your story. Who are you, and how did you become the ambassador, the kidney ambassador in Kenya?
Okay, thank you, Steve. In 2017, I was diagnosed by end-stage chronic kidney disease, and it became a shocker to me. I've never heard of it. It was a surprise news to me. It was quite shocking. Now, when the doctor said that I'll be using a machine to purify my blood, it was not easy for me to take up that news from him. I needed someone to counsel me and then go through the process of accepting. In fact, many a times I became problematic when it came to treatment because I had some mental problem and loss of memory, and then I mean, it was not easy to accept that now throughout my life I'll be supported by machine since my kidneys no longer work. Okay, what happened thereafter? I started dialysis treatment for a period of 3 months. Then slowly I began to accept the reality that without this treatment, I'll be no more. Maybe life expectancy is 3 months away from the time you are diagnosed by end stage. So I had to accept it. The moment I accepted it, it became my turning point. And I started getting interest in knowing what about dialysis, why was it that I just walked into the hospital and receiving this all of a sudden? Why not? Why me? Or why me? That was the question that drove me to now start asking so many questions and wanting to know more about dialysis. And thereafter, I managed by accepting that chronic kidney disease at stage 5, it has no cure. However, only 2 optional treatments are available. It became my turning point. So from that point, I decided that I also want to share my story with others. Maybe there's something I never did right. That's why it ended up to end stage. For example, if from early stages of chronic kidney disease, the symptoms are not present, are mild. You can ignore them. So I tend to believe that some years back, because chronic kidney disease is not instant disease that puts you down, I have come to realize that it goes on progressively to the point where you lose total function of your kidney. All right. So when you lose total function of your kidney, then that is a point where you come to get into end stage chronic kidney disease. Now, this one has to do with neglecting early symptoms like maybe nausea. Sometimes you feel anemic, and you just take them for granted. I think that one could have contributed to my problem. So I am out to voice, to champion, and to create awareness so that even up to the next generation should not have, should not go through what I've gone. I am aware that maybe if early diagnosis is made, then you can never progress to end stage or to another stage. You can delay progression. So that is what drove me to create this awareness. And that is how the FIGO initiative was born. So it was out of need to create awareness. So in fact, I coined the name the Kidney Ambassador because I wanted to put my voice at the forefront so that it becomes the voices of those who have no idea about chronic kidney disease. Remember, in Kenya, I've talked of kidney disease, chronic kidney disease. 4 million Kenyans are suffering in one way, either in stage 1, stage 2, stage 3. So you realize that it is just basically out of lack of knowledge that we are having the numbers daily here in Kenya. Yes.
So Moses, how many Kenyans suffer from chronic kidney disease?
According to Kenya Renal Association, there are about over 4 million Kenyans.
Wow.
Over 4 million Kenyans from at least any stage. It's about 4 million Kenyan. So you can see those numbers are not just chicken numbers. These are lives. These are lives. And to make it worse, 90% of all the population, the 4 million that suffers from chronic kidney disease, 90% of the number are not aware that they have chronic kidney disease. That is why the campaign is here now with us.
Oh, Moses, I wanted to let you know we have contributing nephrologist commenting, Dr. David Moskowitz out of Florida. And he's been preventing 90% of kidney disease since 1994. So he wants to reach out to you. He says, Moses, let us prevent end-stage kidney disease in Kenya together. So he's definitely a good physician to reach out with. He's with Geno Med. and he's coined the prevention nephrologist. So that's Dr. David Moskowitz on Facebook. So definitely reach out to him. He says kidney failure is completely silent. Don't blame yourself for not taking good enough care of yourself. Only a blood test can detect it. We need to test the population. So that's from Dr. David Moskowitz. Again, the preventive.
Thank you, Dr. David.
Yeah, the preventive nephrologist. He wants to know, how can he reach out to you?
All right. I'm on Facebook, Moses Kennedy.
Okay.
I'm on Facebook, Moses Kennedy. Then,
now,
of course,
go ahead, Moses.
I am on Facebook, Moses Kennedy.
Now, Moses, are there a lot of dialysis clinics in Kenya?
Yes, there are so many dialysis clinics in Kenya. However, most of them are not functionally operational. Most of them are just by sheer of registration and black and white paper. It's only in the paperwork that most of the dialysis units in Kenya does exist. So you realize, even if you were to Google today how many dialysis are there in Kenya, then you will be shocked. The number is so big, but we should be asking ourselves one question: are all these dialysis units functional? Are they operational? Do they adhere to strict rules that is required within dialysis units? So there are so many by number, just so many, but few operates with the standards, required standards.
Mm-hmm. Now, Moses, let me ask you, if one wanted to do home dialysis in Kenya, would they be able to do home dialysis?
Yes, there is home dialysis in Kenya, but it is not accessible to the low income. In fact, to put it clear, home dialysis is a preserve of the affluent Kenyans.
Wow.
Because even the national insurance does not cater for that home dialysis. In fact, I'm aware so many have never heard of home dialysis. Personally, I've not even seen one, but I've learned about home dialysis on YouTube and whatnot. Personally, I've not seen one. So you can see how inaccessible home dialysis is.
Mm-hmm. Moses,
yes.
Chelsea Roman, kidney warrior here in the United States, wants to know, how is dialysis paid for in Kenya?
In Kenya, dialysis is paid for by the national insurance, health cover, Kenyan health cover. Okay, so it is through this scheme that the government provides 2 sessions in a week. It means even if you need 3 sessions in a week, then you have to sort yourself. In Kenya, the government only pays for 2 sessions in a week for 4 hours, meaning 8 hours in a week. Okay, but then for needy patients who need maybe thrice a week, are not unable to get it. That is the sad story about it. Yes.
Yeah, because here in the United States, it's 3 times a week, anywhere from 3 to 4 hours. Maybe some patients depending on their size, may get 5 hours, 4 hours, and 45 minutes. But that's a travesty that they only pay for 2 times a week. That's only 8 hours a week, where the person here in the United States, if they were only doing 3 hours, 3 hours per treatment, that would be 9 hours a week, 1 hour more than what the government pays in Kenya. And that's a travesty, as you said, because you may need more than 8 hours a week of treatment. Is that right, Moses?
Yes, there are patients who need more than 8 hours in a week. So you imagine it's like your body remains with all the dirt in the blood for those hours up to the next dialysis. So it makes you as a patient not to live quality life.
Moses, what
Yes.
about transplant in Kenya? How prevalent is transplant and donation?
The Kenyan government has made stride in kidney transplant. Today, there are 2 government hospitals, national referral hospitals that does transplant. This is Kenyatta National Hospital. It does about 300 transplant annually. So that this is way below the number. And Moi Teaching Referral, it does about 200 annually. You can see now this is putting pressure on dialysis units around. Okay? And then when you go to private hospital, there are few hospitals, like just 1 or 2 that has the capacity to do the transplant. Okay?
Right. Now, how is the donor
Yes.
selected?
The process is vigorous. It has also a lot of challenges in Kenya. For example, when it's come to legal aspect of it, policies are not there in place to promote transplant. Okay.
Okay.
Yes. So you will realize that once you want to have a transplant, number 1 is you must have immediate relative. The law doesn't allow none other than your relative to donate an organ to anybody other than a relative. So you can see, if already you are a kidney patient and you belong to a family, of course that family is also at a risk, because maybe if you have diabetic history, it means if you don't get it from the family, you are done. You can't do a transplant. This is where the challenge comes in. Okay.
Wow. There's no way that law can be changed?
Okay, at the moment, through the Association for Patients in Kenya, renal patient in Kenya, they are trying to work out some few legislation to do this, but it is not still easy. I know it will take time. It will take time. So patients will have
basically
to dialyze.
What you're saying, if a person relative doesn't donate to them, then they have to remain on dialysis for the rest of their life.
Yes. That is just one of the challenges. There are so many challenges why there is slow rate of transplant in Kenya. So if that one doesn't happen, you basically you are out. You are out. You don't qualify for dialysis. You don't qualify for transplant. You go back to dialysis. You continue with dialysis, not knowing when you will do the transplant. So dialysis remains your only hope.
Wow.
Yes.
Now, let me ask you, does the National Health Agency or service pays for, like if someone has issues with their access and they got to go to the surgeon, who pays for that?
Okay, at the moment, the National Insurance Fund, the government insurer for health, doesn't cater for such bills. It only caters for transplant, which it gives about $500, and then 2 sessions for dialysis. Okay, so that is the package. Up to that, nothing more. The package is very clear, very short. Just if you are going for a transplant, it gives you 500,000 Kenyan shilling. And then if you have some blocked catheter, then you need to sort it out of your pocket. Or if you need any form of surgery or any form of investigation. Like personally, I had to, just last week, I had to do a parathyroid hormone test to see how my bones are working. But I had to do it out of my pocket. It has taken me so long. So this is
wow.
Yes, this is how the package is limited.
Wow. Now, what if you need, say, some medicine for anemia or some iron medicine or vitamin D? You got to come out of your pocket as well and pay for that?
No. The only thing that the government does when you dialyze at a public hospital, which in most cases are crowded by patient has to wait, sometimes even up to 2 days waiting. It means if you have a session on a Sunday or on Monday, then you must go a day earlier. But then the government, through the 2 referral hospital, they might give you, but they are, in most cases, the drugs are not available. They cite issues like supply and whatnot.
Wow. So it sounds
Yes.
like some big changes need to take place. So, our brothers and sisters, kidney warriors in Kenya can get the treatment that they receive here, like United States, 3 times a week, 3 to 4 hours. Everything I feel needs to be the same across the board. There's evidence shown that kidney dialysis twice a week or hemodialysis twice a week at 4 hours, that's really being under dialyzed, Moses. What do you think?
Well, it's an underdose. For example, if sometimes you happen to not follow the diet, maybe because of the so many reasons that awaits you as a dialysis patient. Remember, there is financial constraint, there is heavy, whatnot. You happen to not follow strict diet. Imagine how your blood, or how unclean your blood could be for those hours before you get to the next treatment. It is something that it's a big challenge.
I'm sure. We had a question from Brian Adala, and he asked, can a person on dialysis drive? Absolutely. In fact, Moses, yesterday we chatted. You're on dialysis and you were riding on a motorcycle. Isn't that correct?
Yes.
Mm-hmm.
Yes, like I use a motorcycle sometimes as my means of transport. So, or I use public vehicle, what we refer here as PSV, a 14-seater van. So sometimes I ride on motorbike, sometimes on a van, a 14-seater van, to get to my dialysis center. So you can see other risk factors that we are exposed to. Yes, because imagine 14 patients, 14 people huddled in one matatu, in one van. Don't you think even there is high chances of contracting COVID-19?
Oh,
Yes.
absolutely, especially if you don't have masks on and they're not practicing social distancing. Hey, Moses, Dr. Moskowitz, he wants to know, why did your kidneys fail? High blood pressure or diabetes?
Fortunately enough, I've never had history of diabetic. I've never had history of hypertension. It all started sometimes back before I was diagnosed. I had an obstruction from just within the neck of the ureter. And then I went on to see a urologist, and then it was corrected. It was corrected. A uroscopy was done, a urethroskopy was done, and then it was corrected. Later on, just recently, because I've been asking so many questions, I've been wanting to know answers why my kidneys failed. I did another urethroskopy, and then it never showed. Then I did a CT scan for the abdomen. Then it was realized that the ureters became narrow, and perhaps that could have been the cause. It is, they are not sure, but then that is up to that level. That was the discussion with the urologist, that I had some narrowing at the ureter, and therefore I was not able to empty my bladder completely.
Okay. Hey, Moses, Chelsea asked, how far do you live from your dialysis center, and then how do you generally feel after treatment?
Wow. Just like most patients, you are worn out. After dialysis, you are worn out. I just retreat to home, get to bed, sleep until tomorrow. Until tomorrow.
Right. How far do you live from your clinic?
It's about 9 kilometers away. It's the nearest. It's 9 kilometers away from where I live.
9 kilometers. So what's that in miles? I mean, how did it take you more than a half an hour to get to your place?
It takes me about 45 minutes to my unit.
And that's the closest, so 45 minutes.
That is the closest.
Wow.
That is the nearest. There are people who go, I thank God, to be close to dialysis unit. You know, there are people who dialyze up to hundreds kilometers away. Like you travel a 2-hour journey, 3-hour journey, 4-hour journey. We have some counties in Kenya that patients go as far as 4 hours journey to get to dialysis. Okay. We have few arid and semi-arid counties in Kenya that patients travel that great mile to seek for this life-saving treatment.
Wow. Wow. And
Yes.
see, it's the opposite over here where, you know, they waste medical supplies. They have an overabundance of renal treatment centers throughout urban communities in the United States. And here in Kenya, you know, even though, like you said, you have many, but a lot are closed down, and you just can't get fundamental care at least the basic 3 times a week. Dr. Moskowitz asked, do you think, Moses, that Kenya will ever pass a law allowing cadaver kidney transplant, or is it impossible because of religious principles?
There are so many. Okay, there are so many aspects pegged to this. Whether the law is passed as soon as possible or not passed, it will still remain a challenge because Kenyan people are more religious. Most of the religious population think that having part of their dead removed could be a taboo. So even if the law is passed today, I know it might take long for that law to be passed, but if that law passes through today, then Kenyans will also still take time to embrace that law. So it is not something that can happen maybe in 5 years' time or 10 years' time. It will take time.
Right. So Moses, what do you think you as an advocate and other people such as myself, advocates for kidney disease, can do to change that mindset, that religious belief of Kenyans and other countries that have a high rate of kidney disease that may have that same thought process?
Through advocacy, Kenyans can get to know, or rather, the society at risk can get to know that kidney disease is manageable, is treatable. And if we embrace transplant as the solution, then many donors will come, whatever way, be it from living donor or not. People will come up when all the population is well, when all the population has the info regarding a transplant. You know what happens? The problem is most of us are not aware that you can survive with one kidney and donate one and save life. If that awareness is there, then it means we can make miles. We can go miles in terms of transplant.
Mm-hmm. Speaking of that, Moses, Dr. Moskowitz wants to know, is Kenya a Muslim country? And if so, could Muslim imams campaign for cadaveric kidney transplants?
The most populous religion in Kenya is Christianity, then followed by Islam. But you see, all these denominations, all of them regard followers of both religions, they treasure the dead ones. Okay, so something like chopping off some parts and donating it. It is something regarded with a lot of taboo.
Got you,
Okay?
got you. Now let me ask you, how is the news reporters in the media in Kenya, how are they treating kidney disease? I know you're trying to educate the population, but are you speaking to reporters, and are they getting the word out?
Yes, as an individual, I've spoken to few reporters regarding chronic kidney disease, but as much as the government is trying to make some few adjustments for accessible for chronic kidney disease, at the end of it, it still lacks the capacity to reach out to the most needy ones. Yes, the government is doing something, but then there is that lack of capacity. Our institutions are overwhelmed. Doctors, hospitals, they are overwhelmed with other non-communicable diseases also.
Okay. Wow. Wow. So Moses, if your fellow Kenyans are watching this broadcast tonight, ones who have kidney disease or don't, what do you want them to know? What message do you want your fellow brothers and sisters in Kenya to know about this disease?
The message is clear that we need to get tested as early as possible. The message is quite clear. We need to get tested as early as possible. And you will realize that out of all the renal patients, have no idea that they are suffering. So it is through that awareness that we can fight the disease. Let's get tested. Let us all get tested. In Kenya, we can do a simple test as urine test.
Mm-hmm.
Yes.
Let me ask you, Moses, do you think a lot of people in Kenya take this disease serious?
No. Just like when I got diagnosed by end-stage chronic kidney disease, I came to realize that there were some few symptoms that I used to ignore. I could travel 400 kilometers without having some short call throughout my journey by road. So sometimes you just ignore a simple symptoms as such. So it means if all of us can be as keen as possible to identify any single symptom, then the better.
Absolutely. Absolutely. So Moses, do you have a support system?
Sorry?
Do you have a support system like family to help you when you're not feeling your
Yes.
best, like a wife and
Yes.
kids?
Yes, my family has been quite supportive, especially my siblings and my parents. And friends also form part of my support system. I've had quite supportive friends. I thank them wherever they are. Congratulations. Keep it up.
Do you see yourself getting a transplant?
It's something I've thought of, but I know I may not have it very soon. For one, if I had to do a transplant today, I'll be able to get a donor. My younger sister, is willing to donate, but then the major challenge is the post-transplant medication is something that I'm afraid of. I cannot afford. That is why I've just opted to continue with my dialysis.
Okay.
Yes, and it represents other patients also, because most middle income and low income patients are not able to afford that. $40 a month is someone's salary in Kenya.
Wow.
So do you take all your wages and pay for med? What of other bills? So I'd rather remain dialyzing than to attempt a transplant, and then later a few months I get rejection because I cannot keep up to drugs. Yes, so most of us will rather remain in dialysis.
That's unfortunate. That's very unfortunate.
Yes.
We're here in the United
But it is
States.
the reality.
It's just an abundance, but some people may take it for granted. Where in your country, just the simplest thing matters. And here in the United States, you have people that are on dialysis that may, not all, but some may take for granted. I work with patients who miss a month of treatment and they come on the last day, where if you miss 30 days, or if you miss a month of treatment, the facilities here in the United States can discharge you from that facility. So it's an upside down situation to me, where the overabundance of treatment centers, supplies, the waste of supplies here, and the overindulgence, that some of that stuff can go overseas to supplement or support or assist facilities such as where you're at, to where warriors can get 3 days a week instead of 2 days a week. So, Dr. Moskowitz also says Kenya needs to prevent dialysis and focus on transplantation instead. What do you think about that, Moses?
Sorry, can't hear you.
I said Dr. Moskowitz says Kenya needs to prevent dialysis and focus on transplantation instead. What are your thoughts? Can you hear me, Moses?
No, I can't hear you.
Can you hear me?
Yes, I can hear you.
Okay, so Dr. Moskovitz
I can hear you.
mentioned that.
I can hear you.
Okay, that Kenya needs to prevent
Yes.
dialysis and focus on transplantation instead. What are your thoughts?
Yes, that is the way. Preventing dialysis is one of the best approach in tackling chronic kidney disease. You know, in the first, I know all over, dialysis is quite expensive even than transplant. It is the best, it is the most expensive form of treatment than even transplant. You can imagine 18,000 shillings a week is what you need in Kenya. So avoiding transplant, avoiding dialysis is the best way to go. We can avoid this by just informing the society the best way to live, good diet, visiting hospitals, seeing a nephrologist, and doing your blood work test. Yes, so that even if you happen to be on maybe stage 1, stage 2, then the progression can be delayed and we can avoid dialysis. It is the best approach to avoid dialysis. Yes.
So let me ask you, for the lower class of the population in Kenya, would they be able to afford like fruits, vegetables, like the dietary measures that's needed to reduce hypertension and diabetes?
Well, for both the middle class and the middle and low income earners, diet has been a problem. Renal diet has been a problem to them, because you realize most restaurants or eateries, they do not have an idea that people must eat healthy. Sometimes you are forced to take some snacks, but you have nowhere to get rich to your renal diet. So it is something that is a big challenge. Next, number 2 after medication and other form of investigation. Renal diet is a challenge to most of the patients. They cannot afford it. They would rather eat anything which is not considered renal diet than to sleep hungry. Yes.
So you're saying there's no renal dietitian in Kenya?
There are, but just as I did mention, the infrastructure in Kenya sometimes does not call into action when it's come to other things like dietary and other form of investigation, clinic follow-up, because this one involves money. If low-income earners, after paying all their bills, they are left with nothing, they might be aware of good diet, but what next? How would you go and steal somewhere? No, you wouldn't. You would rather pay your house rent, maybe allocate your transport bus fare to your center, and then the rest leave it to God. You live by day after day. You yes.
Are
So
there pharmacies in Kenya?
yes, quite a number of them. Quite a number of them. So many pharmacies. But again, everything, you know, it's being dictated with your pockets. Yes.
Wow.
Everything you would want pertaining renal, good treatment, good diet, it all depends with an individual. It is there, yes, but I'm not saying it is there. The reason being, it is not accessible. It is something preserved for the few.
Wow. That's unfortunate. That's unfortunate. So, well, Moses, as we wind down, what do you want people who's watching this show to know about our fellow warriors in Kenya and your message?
My message has always been clear that we must always support one, awareness, and then two, through other partners, we've been advocating for some form of legislation. Okay. Then three, we also need to embrace those who are suffering from kidney disease. They need your support. They need your company. I mean, they need you to walk in that journey with them, so that whatever challenges they undergo, you can also have an idea of, or rather get a way of supporting if you really understand what renal patients go through. Now, we must get tested. We must get close to our health facilities. Do as simple as urine test. That one can even give a clue as to whether you are suffering from any form of chronic kidney disease or not. Okay.
Right.
And
right.
then yes. And
oh, okay. Hey, one more question, Moses. From Chelsea Roman. She wants to know, I know you mentioned this in the beginning, where are transplants performed in Kenya and how are they paid for?
Okay. You can go to transplant in Kenya. It's paid by the government, $500 for the treatment out of $2,000. You need $2,000 for a transplant, but the government pays
That's
$500.
Here in the United States, they charge up to, I guess, $100,000.
Ah, wow. So the government pays a quarter of the figure needed for your transplant. You can as well go to a private hospital if you are privileged, and it goes up to $30,000. I mean, $3,000.
Wow, that's still low.
$3,000
for a transplant.
Yes, 3,000.
Wow.
So it is beyond the reach of so many patients.
Right.
You just as I had mentioned earlier, you need some other logistics, transport, post-care, you need a caregiver, whoever is taking care, you need to facilitate him. So it might even go beyond that. It is not pegged on that amount.
Mm-hmm.
Yes.
So Moses, again, Dr. Moskowitz, I encourage you to reach out to him on Facebook after the show or at your earliest convenience. He says, Moses, thank you for your eloquence. You're a wonderful kidney ambassador, and I would love to work with you to make Kenya dialysis free.
Thank you, doctor. Thank you so much.
Yeah, so definitely reach out to him, man. You know, he's definitely a good guy. He's been on the show.
I'm just going to reach him now on Facebook. Then thereafter we can link with other. We can link later after linking by Facebook.
Oh, absolutely, absolutely. Anybody before we close the show, Moses, you want to say hello to or give a shout out to?
Okay, my shout out go to my mother and the entire family, and then to my friends who have been quite supportive from the time I was diagnosed to date. You are so awesome. My prayers are always with you, that you will live not to experience this what I'm going through. I am proud of you all. God bless you.
Wow, awesome, Moses. Again, we had so much feedback on this particular show than we did the first one. I hope this can be the start of many more conversations between the U.S. and Kenya, and how can we solve this big crisis of kidney disease and fight the war on kidney disease. Chelsea Roman, she wants to thank you so much. She says, thank you so much for this amazing conversation. She learned so much, and thank you for all the work both of you are doing. So, Moses, again, I want to thank you for coming on and setting up this broadcast. This was very engaging, very inspiring, and learning more and more about the Kenyan population and how dialysis is dealt with in Kenya. And prayerfully, as we continue to do these shows, we can educate and collaborate to get the word out, and also educate fellow Kenyans and fellow Americans and anybody on dialysis, education that pertains to living a quality life in spite of being on hemodialysis or any form of kidney dialysis. So I want to thank you again for coming on, sharing your story, sharing your thoughts on kidney disease in Kenya, and look forward to many more discussions with you and possibly fellow Kenyans that can come on to share their experience. We lost Moses, so with that being said, Kennedy, you're welcome. You're welcome. And anytime you want to come on and share your story, if you're a warrior, please reach out to Moses, reach out to myself on Facebook Messenger, and anyone else who want to come on World Kidney News International to talk about here in the United States, the 9th leading cause of death in the U.S. And unfortunately, the leading causes of kidney disease here in the U.S. are diabetes and hypertension. So with that being said, I'd like to thank everyone for hanging in with us for an hour of your time. We know it's a beautiful day wherever you're at. Some places like East Africa, it's nighttime. Here in U.S. right now, it's 1:15 Eastern Standard Time, USA. So again, thank you guys for watching. God bless you. Follow me, Steve the Kidney Nurse, on Facebook, YouTube, Instagram, and Twitter. And we're going to keep doing what we're doing, fighting this war on kidney disease and doing everything we can to make everyone aware of what's going on. Thank you, guys. God bless you. Stay safe. Peace and blessings. We'll see you soon. God bless.